on Health, John O'Sullivan, to respond and conclude the debate.
Fellow delegates, can I begin by adding my voice to the welcome to Dr. Gerry Cowley to the Labour Party? And can I assure Gerry that we will make full use of his expertise, his experience and his passion about the health services. Delegates, the theme of our conference this weekend is One Ireland, Jobs, Reform, Fairness. And these messages are at the core of Labour's plans for the health services. Reforming the way in which healthcare is delivered to a one-tier universal service is rooted in our values of fairness and solidarity. When we first advocated the universal insurance model back in the year 2000, we were a lone voice. Since then, many other voices have been added to ours, including the Irish Nurses and Midwives Organisation, the Irish Medical Organisation and the Irish Congress of Trade Unions, and our likely future government partners, Fine Gael, and we welcome their voice as well. We welcome all these other advocates for change, and we are proud to have initiated the national debate in 2000, a debate which has been ignited again this week through the conference organised by the Adelaide Hospital Society, at which our party leader, Eamon Gilmore, spelled out Labour's intention to make this reform a reality in government. And I, as health spokesperson, want to restate clearly to this party and to the nation that Labour in government will bring in a single system that is unified, fair, delivers primary care free to all, and prioritises hospital treatment on the basis of medical need, not the money in your pocket. Delegates, it has become obvious to many people that we are right. In the past 12 years, spending on health has increased by €10 billion, but the money has gone into the same old inefficient system run by a huge centralised bureaucracy that pays hospitals a fixed sum, no matter how much work they do, and that is headed by a nominal Minister for Health, hands-off Harney, who doesn't want to know about any of the distress that patients experience every day of the week, particularly in our hopelessly pressurised A&E departments, that she declared a national emergency 4 years ago, when she at least pretended then that she was interested in health. And if anybody heard her bizarre argument against universal health insurance this week, I think she's totally lost touch and is completely out of touch with reality when she said that jobs would be lost if we introduced a universal health system. Delegates, Harney should go. Her so-called reform programme has failed along with her party and her ideology. In the US, President Obama drove his health reform plan on the basis that there was a moral imperative to make the system fairer. We share his commitment to that moral imperative, but added to that is an economic imperative. Ireland cannot afford to keep wasting scarce money on a broken system. As soon as we are elected to government, we will begin implementing our plan. Training more GPs, building primary care, maternity and other essential facilities, using the Strategic Investment Bank proposed by Labour, and dismantling the dead hand of centralised bureaucracy by reforming the way hospitals are paid to a money follows the patient model. No longer will hospitals be incentivised to keep people on waiting lists who need care and to keep people in beds who don't need care and to give preferential treatment to private patients. Labour will not renege on our public hospitals and public elder care homes to favour the profit-driven sector that has so pervasively infiltrated healthcare under Harney's tutelage and protection. We will bury the dead co-location project, and we will ensure that the profit motive does not control the implementation of universal health insurance. And we particularly welcome the support of the health unions in relation to universal health insurance, because we're lucky to have such professionals working in Ireland. And we intend to keep nurses, doctors, laboratory workers and therapists working at home, not to drive them out. Reform, fairness, but jobs too are at the heart of Labour's health plan. And we intend that our healthcare workers will again be able to take pride in the service they deliver. Delegates, I'd like to thank the proposers of the motions that were debated here this evening and the members of the party for your strong commitment to the values that shape Labour health policy. We will deliver a fair and efficient health service in government, and the sooner that comes the better for the people of Ireland. Thank you.